All right. So welcome everybody to the third of our webinar series of the Canadian Society for Sociology of Health. I'm very pleased. My name is Ivy Bourgeot. I'm a member of the advisory committee, and I'm very pleased to have another member of the advisory committee, Cecilia Benoit, to deliver the lecture today. As I mentioned, if everybody could mute while Cecilia is presenting. If you'd like to ask a question while she's presenting, you could post it in the chat for either for me to ask or if you would like to ask, and we'll open it up that way. So welcome, Cecilia, and I will let you go ahead.
Thank you, Ivy, and thanks everybody for coming to hear this webinar today. So I wanted just to say that the idea came from a chat Ivy and I were having maybe a couple months ago when we were seeing the emerging or re-emerging inequities related to various populations confronting the COVID virus pandemic. And we were thinking about, how we have seen this before and how important the sociology of health and intersectionality perspectives and methodologies are in helping us to understand these inequities that we see emerging in Canadian society and actually globally. So I offered to do a webinar to kind of just remind ourselves of the importance of the perspectives that we have available to us and how we might be able to apply them to understand the inequities of various populations or groups that we are working with in our research projects too, and then thinking about policies and that might be able to improve the situation both during the pandemic, but even later. And next slide, please. So these are just the goals to kind of think about or reflect on the contribution of sociology of health and understanding social inequities across time and place, and thinking about the contribution of intersectionality, especially for understanding the situation of groups in our society who we have difficulty having good data on and who face intersecting inequities in their lives. And I'm going to focus on people in sex work, but you could use these ideas or these approaches to understand other people as well. And I'm also going to think about the utility of this approach to understanding the inequitable impact of COVID pandemic on sex workers in Canada. Next slide. So first, just a little looking at the social determinants of health approach, and next slide, please. So we all know we have all kinds of examples of the social determinants of health framework from the World Health Organization, Public Health Agency of Canada, and Dennis Rafael and others. And we see it's often a list of determinants, factors, and sometimes a factor is including in a list, sometimes it's not. But what we have here is a fairly static understanding of the determinants of health, a bit better than we had before this perspective, in the sense that some important determinants are listed, but we don't know what determines what and how this might play out over people's lives, both as well as their geographic location. Next slide, please. So quite a long time ago, actually. So this is maybe 20 years ago when I was working for the BC government in regard to a project on women's health. We developed a kind of more dynamic understanding of health determinants model, and we were also using some sociological work that was emerging at that time, especially from Joe Phelan and Bruce Link around the fundamental determinants of health. So they had not put sex and gender as really fundamental determinants. Bruce Link and Joe Phelan were really focusing on social class. But here in this model, we were thinking about adding to social class, looking at sex and gender and race, ethnicity, Also immigrant status, really important, age, geographic location. You could add others as fundamental determinants, but these seem to be, during that time in the literature, really important fundamental determinants in the sense that they're embedded really deep in the social structure, really deep in people's lives, and they determine, as Bruce Link would say, access to key resources. I've listed some of the key ones here: employment, education. He didn't mention childcare, but we added childcare, safe neighborhoods, health services, but we can think of other resources that are extremely important. But these are really determined, these resources, by those fundamental determinants, and they also then affect people's behavior, and including smoking or drug substance use, diet, exercise, all kinds of other kinds of these proximate determinants which we can actually see visible in our lives. The other determinants are much more invisible, but much more grounded in the structure of society. And then these determinants then affect our morbidity and mortality. And you can think about morbidity in regard to having being exposed to HIV/AIDS or COVID or a lot of the other kind of contagious diseases that have been affecting us in the last couple of decades, but also just chronic illnesses as well. And then people have mortality rates that are earlier than what would be predicted given their biology at birth, if you like. So we were interested in applying this particular model to understanding women and girls' health, and in BC, and that's what but it was more general. Next slide, please. So since then, the idea of adding to the fundamental determinants of health is adding stigma. And I've done a lot of thinking about this over the last 25 years since I've been doing a research on sex work, which actually I was invited to help out community groups 25 years ago and try to understand who sex workers are, why they get involved in sex work, what are the health outcomes, what's their health status and health outcomes. And while doing that, it occurred to me how important stigma is in relationship to understanding the lives of sex workers. And again, to go back to Bruce Link and Joe Phelan, they actually had that in the last 10, 15 years have added stigma as an important fundamental determinant of health, side by side with social economic status, with gender and race. They still don't talk about gender, but they do talk about race, and they talk about SCSS, and then they talk about stigma. So this is a model from Bruce Link and Joe Phelan, and they use this model to understand the impact of having a stigmatizing mental health condition, and how that impacted the lives of people with that condition and how it played out over their lives. So you have a cultural designation of value. So there's negative cultural conceptions about mental illness, for example, and you experience these daily indignities. And then you get concerned about being exposed. So people stay in and develop a kind of a stigma consciousness and develop ways to be secret or to conceal their stigma. And that leads to then avoidance from the public, a withdrawal, and then the health impacts on their mental health and well-being. So this is how that stigma power process, and important to remember it's power, because power is not because people want this to happen. This is what happens to them by, the rest of us in society who stigmatize them. Next slide, please. And the importance of stigma as a fundamental determinant of health actually was in the most recent report by our public health agency of officer, Lamb, because she actually helped work on this particular publication. And there she was able to, as well as all the contributors, to show that in regard to race, ethnicity, regard to gender, non-heterosexual gender, regard to people who use substance use and so on. There are a number of examples in this report that shows that, stigma is fundamental to their life chances. It fundamentally shapes how they experience the world and how their health status plays out and how their access to health services are available to them. Next slide, please. So and to go back to, as I just said, the less powerful people are the most likely to be stigmatized. We all can be stigmatized, all absent-minded professors, those kinds of things. But we have the power to throw it off. But people with less power are much more likely to be stigmatized, and it's much more likely to stick over a long period of time. So we just talked about people with mental illness, people who use substances, people who are non-heterosexual, people who are poor, people who have exposed to HIV/AIDS or other contagious diseases, and also, as my example today, people who work in the sex industry. Next slide, please. So I want to spend a little bit of time just to show you how powerful stigma is as a fundamental factor in determining sex workers' lives. And in the research on stigma, we talk about 3 different kinds of taint: physical, social, and moral. And these 3 intersect in sex work, so they experience all of them. And while so someone with mental illness may be experience, or let's say a physical disability will experience the physical and also the social, but they probably won't be blamed for their disability. But for sex workers, all of these 3 intersect. Next slide, please. So we have lots, but there's a long history of associating sex workers with contagious diseases and gonorrhea, syphilis, and so on, even though lots of the research shows that sex workers use, condoms and other protective device much more than the general public do in their sexual interactions. But nevertheless, they get associated with this taint of being loose, and all of us, all of women, are kind of susceptible to becoming, prostitutes if we misbehave. But there is this physical taint, and sex workers being blamed for the spread of HIV/AIDS and for lots of other contagious diseases around related to sexuality. Next slide, please. There's also this social taint. So you'll see this relationship between sex workers and drug addicts. I put in quotation marks. So we see this collapse of these different stigmas around sex work. So, in our studies, which I won't go into today, but the level of drug use among sex workers, it depends on the drugs and so on, but it's much lower than what the public image is of it. But we have this idea that all sex workers are, intravenous drug users, or they're the same as, and even some studies actually, which are poorly put together, they actually go to a drug using population and then they ask them about sex work, and then they come up with their findings. So, as researchers, we have to be careful we don't go about doing the same thing. And the next slide, please. And then there is this moral taint, which is associated with conservative values in our society around sexuality, especially around women's place in society, and around the place of people who don't fit your heterosexual values and views in society. And so this slide here just shows that, you know, the people that sex workers associate with, such as their clients, for example, then they also become shamed, and that in fact affects sex workers themselves. So they become, so this here is about public shaming of clients, and it's become very growing trend. Put it on the internet and said these people here have bought sex, and therefore they should be condemned. And actually, these are the words of our former Justice Minister Peter MacKay when he enacted when we enacted the most recent criminal code laws. So he called people perpetrators, perverts, and calling sex work degrading. So those come. And so the next slide, which just reinforces what I'm saying. So what we have, that moral taint, is actually currently embedded in our criminal code laws. Peter MacKay came up with what he called the Canadian model, the Protection of Communities and Exploited Persons Act. So you can tell by the way that it's constructed that, and his words are that sex work, consensual sex between adults to adults, is actually a dehumanizing phenomena. So there's a value statement here. There's lots of data that was presented to him that, you know, the people are doing sex work are not forced into it. For sure, some people are, as they are in lots of other kinds of work in our society, but the majority were not, and that this was their best choice and so on. But he didn't buy those studies. Instead, you know, went towards a more conservative understanding of the phenomena, and we now are stuck with a law, criminal code law, that actually criminalize sex workers themselves in a number of areas of society, criminalizes all buying of sex, which was never the case in Canadian society up until 2014, and it criminalizes the establishments where sex workers work in almost all conditions. So what it does is puts people in a situation where they are criminalized to a large extent, but also highly stigmatized because of the way that the government has has presented their understanding of this phenomena. Next slide, please. So I wanted to, you know, I think that the determinants of health, especially when we add stigma and we're thinking about these fundamental factors determining, you know, access to resources, determining health behavior, and then health outcomes, that's a very powerful framework for us to start to work with. But also I was searching for, and I think have used, if not like stating it directly, indirectly, kind of intersectionality theory and method as well to understand, in the case study I'm talking about today, the situation of sex workers, their health, well-being, and their access to resources. Next slide, please. So this is just a quote from Yuval Davis saying that the social divisions are constructed by and intermeshed with each other in specific historical conditions. There's a lot of research on intersectionality. I'm not going to go into where the framework came from, whatever, but you can see here that there's a number of what I would call fundamental determinants, but also other determinants such as disability and that you can add, and then look at the intersections where these overlap, and try to think about, you know, what would be the situation of particular groups in your society. So some of these factors will emerge, especially at the intersection of being really important, and some of them will not, depending on the social group that you're trying to understand, depending on maybe even your research question. So but it's really important. It's not just studying and analyzing these factors separately, but trying to understand where they intersect and where power differences lie in those intersections is really quite important. The next slide, please. So these are just some of the aspects of intersectionality that I like, that hold out really utility to me. So I like that it spotlights the relationships between social locations, systems of power, and you can then see where privilege lies and who's penalized in those systems of power. It pays attention to the lived experience of marginalized people. You know, before I started doing research on sex workers, there were no data available. There was nothing. There's no data sets even today. There's no way that you can go to Stats Canada and say, you know, can we show you some data on sex workers? Sex workers are never on a occupational prestige scale. They don't even exist. They fall off. So you can't really compare even their prestige compared to other workers in society. And then we, you know, of course, then we have all of these, you know, they talk about it as the oldest profession, but we have so little data on them. So this perspective helped me to be able to get to get at the lived experience of people who are involved in this activity and try to shed light on their situation. And this perspective, intersectionality, also tells us to be self-reflective. We have to think about, like, why are we doing this research anyway? Like, why are we interested in understanding, say, the lives, in my case, of sex workers? I have had to do so much self-reflection. You know, I held so many biases before I accepted the invitation by the community to try and help them with their research. And I'm still every day, as I do this work, reflecting on my own biases. So I think when you work with marginalized groups, when you work with people who are, as the Stigma framework shows, hidden in the social structure, trying to get by, but having very little power, then we have to think about how much power we have as researchers and also policymakers, and try to take that into account when we're interpreting our data. The next aspect that I like about the framework is that it goes beyond just description of health inequities, which the social determinants of health often was about. It was hard to get beyond description. And instead, you know, like, what would social justice look like for the marginalized group, and how do we bring about social change? So it doesn't mean that you have to be activists, but you have to think about, you know, knowledge translation and interpretation in a way that actually is going to help reduce those social inequities, at least propose to and then evaluate it. So it's the aim at the end of the day is not just to describe, but is actually to think about coming up with policy suggestions, recommendations, and maybe even for practice in healthcare and in other social settings, so that we can actually have an impact on those fundamental factors that we talked about earlier. And the other advantage, I think, of this perspective is that it employs a variety of research methods, including qualitative and mixed methods for gathering data, so that we can get at that variation across but within groups as well. So we pay attention, gather data on those fundamental determinants. And, you know, it's not easy to study stigma. It's extremely important factor, but how do you study it, and how do you get data so that you understand how stigma is measured across marginalized groups, but also within those marginalized groups. And in doing that, you can get at the intersections of various types of stigma and how they play out for inequities, even within a group like sex workers. Next one, please. So this intersectional intersectionality as a theory meta has been applied. I've worked with Olena Havinsky, who's done a lot of work in Canada on this perspective, and we used it quite a long time ago, 2010. It was to look at various populations around where women's health was disadvantaged women, and trying to understand how this perspective and method could help understand their health inequities. And then Elena has most recently actually looked at the intersectional approach, looking at the biomedical approach and intersectional approaches and understanding health inequities. And in this article, they're mainly focusing on HIV/AIDS, but we get the utility of using this perspective for looking at a variety of health conditions, and then even combining with a variety of other approaches. So today I was, combining it with the social determinants of health, but one can use other approaches as well. Next slide, please. So now I want to present a little bit on research I've done on sex workers over the last 25 years, and then thinking about the COVID pandemic and how I would argue it actually just continues the ongoing marginalization of sex workers in society. And so it's not surprising what we're seeing today that's playing out, given what we know already has happened, or how sex workers are located in our society. And next slide, please, Sandy. So I'm not going to present you anything about the studies I've done. I've done a whole variety of studies funded by CIHR mainly, some of them by SSHRC, but a variety of studies looking that are cross-country, so in a variety of geographical locations across Canada, and also using longitudinal data. We've also done studies in the United States and Canada over time, comparing sex workers and other marginalized or other occupational groups. And then we looked at sex workers in a more recent study, but also did studies of sex worker clients, of their sex workers' romantic partners, of the people who manage sex work establishments, to try and get a 360-degree angle on how the sex industry is organized in Canada. We've also done interviews with police and other social providers to try and understand their views on sex workers. And more recently, I have a fellowship with the Pierre Elliott Trudeau Foundation, and that particular study is it's called Beyond the Missing Women's Inquiry, Empowering Sex Workers as Social Justice Advocates. So there I'm really applying the intersectionality kind of theory and method to work very closely with sex worker organizations and allied groups in 8 different locations across Canada to think about designing a curriculum that they could use in their communities to bring sex workers together, to understand the variations among each other, and then to think about ways that they could work collectively to improve their situation in their communities, and also perhaps become, if they feel comfortable, to find themselves having a voice, which is very difficult because of the stigma, as we thought. So I'm going to just be presenting some of the data on sex workers that I know, looking at their situation before COVID, and then thinking about how COVID has impacted them. So in this slide here, you can see that sex workers are much more likely to identify as cis women, also more likely to identify as trans. They're younger than the Canadian population. At least in my studies, the visible minority status is lower than the Canadian population. So not all determinants or factors, play out in sex work, but Indigenous status, look how high it is compared. Sometimes in some studies it's 25%, it's never lower than 19%. And the education, sex workers are much less likely to have finished high school, much less likely to be married or in a common law relationship, much less likely to own their own home. And we also have data on unstable housing and so on. And some other data that is not on that slide is that sex workers are much more likely to have a disability. 30% of them have disability in our studies. And they also have what we call food insecurity. So in the last 12 months, 2/3 of them had received free food or meals. Half had disclosed or that they borrowed money from friends or family to meet their bill payments. And 1/3 said they didn't have the full amount to pay their rent or mortgage. So these are data showing that just a structural disadvantage of sex workers on not all determinants, but many of the determinants that many of them that are fundamental, as we were talking about. Next slide, please.
Cecilia, I was just wondering if you could clarify when they have higher rates of disability, what types of disability are you referring to?
This is in the sort of Canadian Health Survey. He asked a question about disability. So when we asked them follow up, it's all kinds of disability, physical disability, mental health disability. You know, it ranges from a whole variety. And when we ask them a little further, they say often they're in sex work to complement their disability benefit because it's not high enough to meet their, you know, their rent and so on like that. So it's a whole variety of disabilities that people have and often not able to do other jobs, but they can do sex work, having maybe a small number of clients that are regulars.
Okay, thank you for that.
Yeah, you're welcome. So we also asked them how they got in sex work, and I should let you know that who's a sex worker and who's not a sex worker may be a question that comes to your mind. In our studies, we've asked people, or we include people who say that they have had at least 15 sex work encounters for pay in the last year. So we assume them as regular or semi, you know, working part-time. No, it's not just one transaction doesn't make a sex worker. And often people don't even identify necessarily as a sex worker, although our society will stigmatize them as sex workers. So, but it's mainly people who are, I would say we have a conservative measure because we're getting at people who are regularly involved in this activity to bring in some money to either supplement or be their main income for meeting their life needs. So when we asked them about how they got in sex work, you'll see here that it's a variety of intersecting reasons. A very small number have the personal appeal for the work, so they got in because, and you know, and often people. Some entered before age 18, and in our study, the average age when they entered was 24. So they may, especially non-heterosexual people, exploring their sexuality, feeling that they actually are very good at, you know, as a sex worker and so on. Critical life events, though, very high, you know, a high proportion of people. Divorce, being abandoned when or neglected as a young person, a variety of reasons, critical life events. But look at this, the need for money, need and desire for money. So what is money? What is the need and desire for money? Well, this is paying my rent, paying my schooling, paying my child support or child care, a variety, and the desire for money. I want to go back to school, or I want to, you know, I want to put a down payment on a place or whatever. So need and desire for all of us, we have both of those when we're thinking about money. But why are sex workers gotten sex work? Well, it's not a, you know, a big problem figuring it out. It's for the money. Why do we work in most jobs? Is for the money, right? And so so this is important for us to understand, and not the number of people who were forced into sex work in our study. This one here was based on 209 people who were interviewed. There were I think 7 people who said that they were forced to be in sex work before and now that they're doing it because they want it, because they're consenting to it. But early on in life, there was a very small number of people who were forced into it, forced in that kind of way that we hear now about trafficking and so on. So most people had some choice in being involved in sex work, and their reasons are largely to do with their need for money, as I mentioned already. Next one. It may come to a surprise to you, but a large portion, over a substantial minority of people were working in other jobs as they were doing sex work. And we could put student in there too. I didn't add that, but there was also some of the, I think it was 18% that were in, that were also attending school. But these were the other current jobs, so-called legitimate jobs, or jobs that, you know, are available in our society. And if you take a look at them, these are a lot of the jobs that, you know, women do in our society that have been majorly hit by the pandemic. And sex workers are you know, these are the jobs they were doing as well when I was interviewing them. And almost all of them had done these kinds of jobs in the past, and some were doing them currently. So a lot of these jobs involve physical labor, emotional labor, the kind of work that we think women are good at, and they're poorly paid. And they involved a lot of kind of work that scheduling and so on, that you get not a lot of economic reward for. Next slide, please. And I put this slide up because I want to show you that sex workers have agency. Maybe it's constrained agency, but nevertheless, they have some agency. So these were their pros and cons of doing sex work compared to some of their other jobs. So 79% of them said they prefer their sex work. They have higher satisfaction in sex work over their other jobs. And that has a lot to do with they are much more likely to, you know, have clients that they're regulars, or that the people that they feel that don't mistreat them, don't put them down, which is very different than our perception of what sex workers and their clients are in society. I'm just thinking what Peter McKay just said about them. The money is extremely important. They can make more money per time spent in work, in sex work, than they can in these other jobs. These other jobs are much more poorly paid per hour, if you like, than sex work. Sex workers have more control over their scheduling and more control over who they're working with and so on, and their clients, than they have in these other jobs. But the stigma is much, much more pronounced. So these other jobs also carry with them some degrading feeling about them, or some taintness, as I was just, but it's the stigma, the public stigma embedded in laws in our society and so on. That's the worst thing about sex work from the sex worker's point of view. Next one, please. And so this is just about sex workers relate their health. As you can see here, they have poor general health and poor mental health, and they have also much higher unmet healthcare needs. And so, so this is how their determinants of health, if you like, play out in regard to their health outcomes. Next slide. And this is reasons for unmet health needs. So these are asked by, we asked this about Canadians in general, and you see here that we don't really know, didn't get around to it, didn't bother, too busy. You know, these are things that it's hard to interpret, I think. But dislike of doctors or fear of doctors, this is really interesting finding here, I think, and relates to that comfort sex workers have to go to see doctors or other health providers. And then this is one of those economic barriers in regard to transportation, because they're much less likely to own a vehicle then they would have to pay for transportation. So this doesn't tell us everything, but it shows you that unmet healthcare needs are very high, 4 times as high for sex workers than other Canadians, and that there's some important barriers that prevent them from accessing health services. Next one, please.
Cecilia, we just have a question from Cecilia about whether or not these individuals self-label themselves as sex workers, consider that part of their primary identity. And it's related to my question that I also posed as to whether or not these social determinants of health are about their sex work or about the other forms of marginalization they experience, which is hard to tease apart. I was wondering if you could speak to those 2 questions.
Yeah, it's interesting. When we collected our data, that we did use the term sex worker, and also we used people in sex work. We asked, and then we had, as I say, 214, I think, in one of our studies who came forward. When we asked people how they would describe themselves or what terms they would use, they had terms all over the place. And many would say, I have many hats, and one of them is a sex worker. And if you ask me another time, I'm a mother, or if you ask me in another situation, I work as a waitress or waiter. It's very hard, and this is a kind of methodological problem, like what terms should we use? We avoided to use the term prostitute or any of these, what are come as more, even though people would use that term themselves. So, as we know, some people take on terms to flip the tables on people. But what I think generally, what sex workers would say, I'm a sex worker, but I'm many other things, and I'm also a student sometimes, or I'm also another kind of worker, but they have many, many statuses. So we probably didn't include, so we didn't use terms like survivor or lots of other terms that are used in the sex trafficking literature that would attract. So we probably didn't get the most marginalized or most, and we probably didn't get the really high-end escorts too, which may not even think of themselves as a sex worker, maybe as as an escort or personal companion or so on. So the terminology use is extremely important. So as I said before, I think we have a kind of middle of the road group of people who we use a whole variety of methods to try and gather our sample, including going on their websites and asking if they would like to take a part in an interview. And then we also used community organizations to spread the word and use random respondent-driven sampling, so going through their networks to bring in other people. And so, yeah, so we used a term in try to gather our data, but and most people seemed comfortable with the term, but when we asked them how they would call themselves, it would be lots of different terms. Yeah, so does that get at what you're getting at? Yeah, okay. Yes. So thinking about COVID then, I had all this information on this group that I was working with pre-COVID, and I was wondering, what is the impact of the COVID pandemic on them? And we've published a short piece in Policy Options recently on this topic. And I have not been doing interviews with sex workers themselves, but I have been doing interviews with sex worker organizations across the country who have been providing through what we might call mutual aid to sex workers in their communities. I'm not going to talk too much about that today, but basically they have People have donated to these sex worker organizations, and they've been able to give that the little applications they received and be able to give people money to try to make their rent and to get some food and so on. But their situation is pretty dire in many of the communities. So what I'm going to try to do is to then shed light on how COVID, from the point of view of the information I've been gathering, how COVID has affected sex workers, and then what kind of access do they have to the benefits that Trudeau and other governmental agencies have provided, and what kind of access do they have, or what happens to them when, COVID pandemic regulations kind of change and ease off and so on. So what's the impact? And there may be some suggestions for more addressing their fundamental determinants. Next slide, please. So like lots of other people, sex workers have this is going back into, March and April and May, but now we're heading again in this area. Many of them have lost their other job opportunities they had. So many of them have not been able to work for pay, and they've also not been able to work in the sex industry. All the massage parlors have been closed down, escort agencies, and even people who work out of their own apartments and so on are, they don't want COVID to spread, and they don't want to get COVID, so they have had to deal with this. The only avenue available to them has been to work online, but sex workers without that advantage or without the skill set and so on, don't necessarily have the ability to work online. So some people have made money that way, but all the sex workers that I've heard of, they are really not bringing in very much money right now. Even the ones who have access to or have developed and use of very complicated websites and so on. So these are some reasons why I've been told sex workers are unlikely to access government benefits. Now, some do because they don't meet these, or these are not their concerns, but the majority have not been. And why? Well, sometimes they don't have a social insurance number, and they're reluctant to apply for one because they don't want government to find out about their sex work. Many of them are paid in cash, and so they can't report a minimum annual income to qualify for EI or CERB. Many of them are independent contractors rather than employees, so they don't have they're not their employer, not reporting on them, and many of them have not filled in taxes because of all these reasons, and they're fearing this further stigmatization, or they don't want their migrant status to be exposed, or they have other worries. So these are really the overall importance is that there's a lot of factors. There's others that I'm not included here, where it's being reported that sex workers are much less likely to access CERB or even EI benefits and so on even though they've lost a lot of their income. Next slide. And then thinking about it, and I kind of hinted at that, so the more advantaged sex workers, which tend to be, cis white women who look great and they're younger, and, they can have that kind of sexual performance online that is attractive to a lot of clients. They're doing well, or doing okay. They're probably able to pay their rent. But those who face those other intersecting stigmas, they're Indigenous, they're trans or non-status migrants, or they're substance users, then they are having really difficult times. And those are the ones that have been reaching out, not only to sex worker organizations, all of them have been reaching out for help, but these are the ones where sex worker organizations are trying to provide some additional resources for some funding. And unfortunately, because they can't make, the ends meet, often sometimes they actually are meeting clients incandescently, and then they're exposing both the client and themselves to COVID, and even though they're, and then they have to get access to protective equipment and so on. So it's difficult. It's very difficult, but there is a portion of them who are still being active because they don't have any other choice. And at the end of the day, what we're seeing is, well, we know that they have less access to social health and social services because sex worker organizations have closed, and most of their services they can't offer in-house. So their food options that they were, and the nurse options in their organizations, all of these are no longer available, and so the most marginalized sex workers then are, they're probably going to end up with poor health outcomes, and that will just increase their social inequities as the pandemic continues. Next slide, please. So just thinking about some immediate things that we could think of that we could do, Canadians and our law enforcers and others in society could do, just to just stop the further marginalization, would be to don't enforce the criminal code law right now. Just don't. And police often do anyway. In some communities, they never enforce it. Vancouver and Victoria, because of what's happened, with the missing women, they're much less likely to actually enforce the criminal code than in other communities. Don't deport non-status migrants who are coming in, find themselves working in massage parlors, or it's not helpful to them. As you try to deport them, then they're just going to end up in worse situations. Don't scapegoat sex workers as the COVID restrictions ease. There's a case right now that's being tried about, people who work in as strippers in Ontario who are kind of not allowed to go back to work. This is, before the second wave, even though lots of other establishments were opening, and it really, you could only understand it because it was something to do with sex and not to do with drinking, because all the other places were open. So don't scapegoat sex workers unduly, and provide emergency monetary aid without strings attached. And in particular, channel emergency dollars to sex worker organizations. I find it really disturbing that we have all these charities in Canada, and we hear a lot about we and these bigger, but these organizations, you're thinking about Stella, for example, in Montreal, has been working it has a 25-year anniversary right now. It has a proven record of helping people who are marginalized in sex work in its community. And yet, the government has done very little. There's a little bit that went through the Ministry of Women of Gender Equality to these organizations, but not very much. So why do they always have to be like begging for funds to help people who they know where the marginalized people are in their community, and they could do a lot to get the money to them immediately. And often, and money is important. It's not just clothing or that. You got to give people money to be able to pay their rent, to meet their monetary needs. And then some longer term measures would be the guaranteed access to universal basic income or some other social equity scheme, which has been talked a lot about right now in Canadian society. Take the crime out of consensual sex work, decriminalize it, regulate it, and give people access to. It will increase people's options and make other resources more available to them, free education, other things that could help people have more choices in their lives. And really importantly for me is to develop and evaluate some measures to combat stigma and discrimination against sex work in sex workers in Canada. Really hard thing to do, but I think that it's really important for them going forward. Next slide, please. So that's my presentation. I'll take any questions. I was hoping I could do it in an hour, and I did. And I wanted just to leave you with this question, whether this approach is useful for understanding the impact of COVID on other social groups. And I had this discussion with a couple friends of mine the other day when we were walking, because that's how I keep my mental health going in Victoria. And I noticed that a lot of the groups, one academic was studying women with housing needs. And I realized that these populations overlap, you know, like a lot of people dealing with marginalization in our society, they overlap in around these social determinants, these fundamental determinants, and also access to resources and so on. So I'll just throw that question out, but you probably have more other questions as well. So thank you.
Thank you so much, Cecilia. Really, really incredible. And so we have some questions coming in. And so yes, Jerry is doing our virtual clapping. And so Cindy was asking if you could recommend how to improve the social status of sex work, and should they pursue education? And related to that was a question that I had, is that if we went down the line of universal basic income, whether or not that would steer them out of sex work. So is the intervention to stop them from doing sex work and pursue education or get a universal basic income, or is it to make, you know, sex work less stigmatizing, or maybe a bit of both?
Yeah, very good question. Well, I wouldn't want to suggest anybody leave any occupation, and we don't ask doctors, do you want to leave medicine? How can I get you out of medicine, or nurses, how can I get you out of nursing, or professors, how can I get you out of academia? Instead, I think you want to create more options. So work on those, you know, fundamental determinants, give people more access to economic resources, more access to education, more access to, you know, to resources, so they have more choice. And the problem, you know, like I use that term constraint choice. Sex workers, I don't want to say they don't have agency, because they do, and that would be wrong. For everybody in our society has some agency, but some people have much more choices, many more choices than others. And sex workers, you know, they have some choices, but there aren't a lot. Like sex worker organizations, for example, offer business courses. They offer courses around empowering sex workers around health, becoming health advocates. They offer resources around, or courses around a variety of things, working with police and so on, and try to how to deal with that, you know. But those organizations have to apply for funding every year to get to fund those courses, and then of course they offer them to sex workers free. But why are sex workers not have more choice in regard to like the basic income, or free education, or, you know, other free childcare? These are the, you know, the deeper ways that we could open up choice for them without stigmatizing them and saying this is only targeted to you. So that's how I would put it.
So so thank you so much for that, Cecilia. Other questions coming in are sort of like, how realistic do you think some of these immediate and longer term recovery measures might be? And maybe you could choose, you know, one from each and talk about, and how realistic they are, how we could support them being more realistic or enacted.
Well, I would say that these sex worker organizations, so, you know, like sex workers are disempowered in a lot of ways, but I would say they, in the last 20 years, they have become more empowered through these organizations, or and often run by sex workers themselves, or at least have membership there. So not without us, that kind of thing. Mm-hmm. And so they also have a national organization around decriminalizing the law and so on like that. So I would say their ability to get police, for example, not to enforce the criminal code laws in their community. It varies by community, but I think the police have pulled back a lot in doing so. And their ability to get resources to help sex workers get resources. They have complained a lot to different ministries about these inequities, and so they have been able to get some resources. So there's a possibility of some change going forward, but I'm really worried about the next wave of the pandemic, and then having then whether they're going to have to be able to continue to be able to do so. I was talking to one executive director of one organization the other day, and she said normally they have to fundraise for 40% of their global budget per year, but this year they expect they are going to have to fundraise for 80%.
Wow!
So that means that they are going after funds that so many other groups are going after, and then the need of their populations are very, very high. So I'm very worried about Indigenous sex workers. I'm very worried about trans sex workers, and about non-legal migrants coming in, because unless they can get access to resources from some of these other sources, then it'll be difficult. The long range, I think, the basic income is not just sex workers that would be fighting for it, would be so many other groups. So that's where we can have alliances, and that would be very, very important. But also, I think the criminal code law is supposed to be reviewed right now. The Trudeau government has actually postponed it, but the 5-year window was up this year. And so again, it's so much has to do with mobilization and thinking about. It's a very complex issue, and we have a big lobby about conflating sex work, consensual sex work, and sex trafficking. And so as I say, the sex workers are mobilized nationally, but a lot of it depends on what all of us think about it, and how we think about, how do we improve the situation, change those fundamental factors. Is the criminal code law useful or not? Does it further marginalize people? What else could we suggest that would make a difference? And I can say that in New Zealand in 2003, I believe, they decriminalized sex work and adult sex work, and regulated it through actually using a public health lens. So they had public health officers visiting massage parlors and escort agencies, just like you would do with restaurants or all these other places. They also, by decriminalizing it meant that sex workers had access to the Human Rights Commission and all kinds of other mechanisms we have available in society to report when they were being exploited or harmed, and so on. And it's the results from studies there show that people are still doing sex work because it doesn't, it hasn't been a big increase. The New Zealand government is putting more money into childcare. It's doing work on that determinants, and also stigma has decreased around sex work in New Zealand. It hasn't disappeared, but sex workers are reporting they're feeling less needing to hide away, and they can talk a bit more about what they do, and they're less put down in the media and by other sources. So I think change is possible. We have to be hopeful.
Mm-hmm. Well, it's been interesting because there are some sex workers, that have been written into certain storylines in a very destigmatizing way. And I think that that, you know, will also help, you know, changing hearts and minds about that. We have one more question from Hashu, and there's a lot of other comments. People have had to go to other events, but they really, really love the presentation. So thanks so much, Cecilia. So Hashu has asked, I'm curious to know your thoughts about the role of intersecting determinants of health on misinformation or disinformation in the COVID context on different marginalized populations, including sex workers.
That's a hard question.
Mm-hmm.
Yeah, I think that it's like when HIV/AIDS emerged and other contagious diseases, that we have to be really careful that one group or a few groups don't get pulled out and as being misbehaving or or being the cause of that. And that's a little difficult to do with COVID. We're trying, it's not, but we had it at the beginning where people from Asia were like stigmatized, and then with COVID, we what we have is I think, when I look at the work around in relationship to sex work, and I guess with other marginalized groups, we see, let's say for homeless people, we do get, or people who are using substances, you do see that there's a public kind of outcry against them, and that COVID kind of feeds that outcry. So I'm thinking here about people who are in tent cities in Victoria, where we have a really, really big homeless population because it's a place where people can come in the winter. We also have a major overdose problem. And so what we have is money going into housing these people, into hotels and so on, but still a lot of people who are visible. And so, when people put COVID into that, and often people can't behave the way the COVID regulations. How can you physically distance when you're living in a camp? And so then they become stigmatized very quickly. So I think these intersecting determinants can kind of play out in the media and in actually in our neighborhoods, because we who are advantaged are able to follow through with the regulations much better than some others. But excellent question.
A lot of people have talked about how social distancing or physical distancing is very much a privilege, right? And it's very much sort of a, a middle class, view of what you can and cannot do. Yeah. So thank you so much, Cecilia. Those are the main, and there's lots of wonderful comments. I'm going to stop recording now.